this has been the perfect opening for us to bring you actually two very, very inspiring panels. And it comes back to what we had earlier with the patient advocate testimonies. And that is the amazing work that's being done, again, on the ground by the patients, by the families, by the patient organizations. So we're going to present you, first of all, a panel discussion from rare diseases in Africa. And we're going to end it with a bit of a live presentation from Michael about the African Summit, which took place in December of last year. So we'll go to the African Summit, go to the rare diseases from Africa, and then we'll get a chance to actually speak directly with Michael about it. So, you know, this is this is an amazing opportunity in terms of Africa. Because if you can imagine, you know, Kelly and I were talking about, 2016, I think we met in Edinburgh, and this was still just a thought. I mean, there was nothing really of this nature in Africa. And these are the families and the patients and the organizations that have built this from the ground up. So we're just so delighted to be able to have the opportunity to share some of that and then to be able to have a conversation with them. I want people to start thinking about that. There will be an opportunity after the second panel presentation on Africa and beyond for you to actually ask some questions. We've got a number of these delegates that are here. They're going to be able to answer your questions for you live, and we will hopefully have a discussion with them. So think about what it is that you want to ask them as you're listening to the presentations, and we will be able then to invite them to come up here and speak with us. So we'll start with the first panel on Rare Diseases Africa.
Hello, Durham Wong Rieger, Chair of Rare Diseases International. I'm so happy to be here today with this wonderful panel to talk about rare diseases in Africa today. We're coming to you from Dubai, and we have 5 amazing panelists whom I'm going to introduce, then have them talk a bit about what they're doing in Africa with regard to rare diseases, and importantly, of course, talk about what the impact of the UN Declaration on Rare Diseases is going to be able to do for them and how they're going to actually be able to contribute to it. First is Rana Saifi, who's the Regional Manager of Eastern Mediterranean World Federation of Hemophilia. Also with us is Rajlan Kanja and Christina Mutena, who are co-founders of Rare Disorders Kenya. Samuel Ueafi, who is the Executive Director for Rare Disease Ghana Initiative, and Kelly Duplessis, who's the CEO of Rare Diseases South Africa. Welcome, and thank you so much for being with us today, and also for all you're doing. I'm going to ask you to first maybe just tell us a little bit about your role within your rare disease organization, kind of how you got, what's your motivation for being there, and really what you feel is the important contribution that you have been able to make with your organization for rare diseases. And we're going to actually do it in about 30 seconds. So if you don't mind, Rana, I'll start with you.
Thank you, Doreen. I echo my gratitude for having been invited to join this esteemed panel. So I'm Rana Saifi. I'm the Regional Manager for the Eastern Mediterranean for us. The Eastern Mediterranean includes 21 countries, and 5 of those are considered to be in North Africa. That's the 3 North African countries of Algeria, Tunisia, Morocco, plus Libya and Egypt. What motivates me is the constant contact we have with the patients on the ground. We are an organization that brings together 147 NMOs, national member organizations across the world. Of those, the 21 in my region, and of the 21, the 5 in my region, I'm in constant contact with the families, the parents, the patients themselves, the doctors, and in some cases where we have contacts, the government. We see where things have worked very well. We also see where things need to improve. And that is what motivates not just me, but my colleagues doing the same job in other regions, making a difference in the lives of the people that we are in contact with and that we are here to serve.
Thank you very much, Rana. That was actually quite valuable in terms of understanding how an international organization can actually have such an impact on the ground. Let me pivot over to Rajlan, and maybe you can tell us your role and kind of what you see as the importance of the Rare Diseases Initiative that you and Christina are involved in.
Hi, I'm Rosalind Kanja from Kenya, Rare Disorders Kenya. I came into this journey because of a child that has Joubert syndrome. And being able to set up an organization that people can come to us seeking answers, seeking references, looking for community. That's the reason why we do this, Christine and I.
Great, thank you much. And Christine, for you personally as well, and maybe just expanding on what Rosalind says, what's the impact that you've seen maybe in terms of your initiative already?
Okay. Personally, I'm a mom to 2 kids with different rare conditions, and that is what stems my passion for creating awareness around rare diseases in Kenya. And if we started doing Rare Disease Day in 2014, and up to date, we have seen enormous growth. We have a community for rare diseases. We have a community for people who are willing to share their stories and enlighten others. So we have seen growth not only as caregivers and patients, but also with the Ministry of Health looking into working on rare diseases. So it's not slow, but it's momentous growth.
Thank you very much. And maybe if I can just go over to you, Samuel.
Starting off as a clinician, I'm a clinical psychologist, and seeing a family come to clinic and not having answers to their condition, living with an undiagnosed disease, has been the great motivation to be able to advocate for a change in the healthcare system that will be very responsive and inclusive and attends to the needs of the marginalized in the healthcare, mostly rare diseases.
Thank you very much, Samuel. Maybe I'll pivot over to you, Kelly. Kelly, I don't know if you're the senior statesman here. I know we've been involved with you with rare diseases, and you've helped to, help set up rare disease initiatives in other countries in Africa. Maybe you can just give us a brief introduction in terms of what your motivation was and what you feel, has been important in terms of South Africa.
Thanks very, very much, Doreen. And also thanks so much for the opportunity. I'm really excited for today's session. So my journey with rare diseases started with the diagnosis of my own son with a rare condition, and that was almost 12 years ago. And at the time, there was no support available in our country for parents or patients with rare diseases. And having to go through our own personal struggle to get access within the country, I saw that there was a definite need for additional support and most importantly, advocacy. Although I didn't understand advocacy at the time, I certainly do now. And I just really wanted to turn our own purpose, our own pain into something that was a little bit more purposeful. And that's how Rare Diseases South Africa was born.
Thank you very much. So you've all talked about the motivation, some of it extremely personal, but obviously all of it really related to seeing what the needs are either of your own family or others around you. What do you feel when we talk about, and of course, Africa is a large continent, and it's not the same in everyone, but within your own political landscape, what did you see were some of the real challenges in terms of getting, rare diseases into either the services or into the political landscape? And what did you find was this particularly helpful to you? What were some of the opportunities that were available to you there? And maybe I'll go back to Rand again, because you've got that big international perspective, looking at, this particular region. How might it be different than others? And what did you feel, maybe were some of the particular opportunities and challenges?
Thank you, Doreen. Obviously, often when we talk about hemophilia and other inherited rare bleeding disorders, Samuel alluded to that a little bit. Diagnosis is a big, big story. It's a big challenge. Often the medical professionals see it as a textbook disease because it's rare. They haven't come across the patients in their training much. So, if we look at the statistics, the expected prevalence is 21 persons with hemophilia in each 100,000 males. So historically, from 1999 to 2020, we have been able to identify about 400,000 persons with hemophilia. If we take those figures to the Eastern Mediterranean, the expected number of patients is 73,000 versus 30,000 identified. So the identification rate in the region in which North Africa sits is still at around 40%. In Africa overall, it is at about 8%. In North Africa, if we disaggregate the data, the country level data, we see some slightly better figures. So in places like Egypt, it's 58%, in Algeria, it's 56%, and then Tunisia, 47%, Morocco, 26%, but the figures are still low. It can be a big challenge. The lab personnel are not trained. The labs are still in many places not equipped. And the key issue is that we can only claim success when all the patients with bleeding disorder have been identified and have access to adequate care. The second big challenge is the age at which the children are diagnosed. And that is also a big story. We have a World Bleeding Disorders Registry. The median age at diagnosis is much higher than Europe and the US, where it could be 8-9 months. But if we zoom in at North Africa, it's lower than Africa proper, where the age at diagnosis can be at 48 months. So why is this a challenge? Because the earlier the children are diagnosed, obviously, the greater the chance they can receive care and avoid complications such as joint disease and disability. And these are issues that have been identified in the resolution. So the target is to treat most in need, those with severe phenotypes, but to treat them as early as possible.
Thank you so much. And that really does put in perspective, as you say, a key challenge around getting diagnosis and early diagnosis. Maybe I'll pivot back to Rosalind and to Christine. Both of you talked about your personal motivation coming in, having a child with a rare disorder, or 2 children in your case. What did you experience in your own case, and what do you see still existing? Is it diagnosis that's the key issue? Is it getting access to the specialist? What did you find, as to be the major barrier in your personal situation, and what you might find in general in terms of your country? Rosalind, maybe I'll go back to you.
Thank you, Duran. So one of the challenges I faced is lack of awareness with doctors. So most of the times, I was a bit lucky that I got a diagnosis earlier. However, for those that I see around me, it takes so long before even a doctor can be able to start figuring out that this is actually a rare disease. It's taking longer. By the time that children are being diagnosed, so much time has passed, so you can't recover what has already gone. The other issue is the issue of here and there, you get the stigma, especially if you have children or you have a family that has several children with rare diseases. Then, of course, the community starts looking at you in a different way. They start telling you something you did or did not do, and that adds to the complications that you already have and have to deal with every day.
That's amazing. Yeah. And really putting it into perspective, right? I mean, Christine, maybe you can just pick up on that. And then I'm going to pivot over to you, Samuel, because I know you're dealing with that whole host of issues in terms of the diagnosis and getting access to a specialist. Is it diagnostics? Is it getting to specialists? Is it, as Rosalind said, dealing with the community and the kind of perceptions that people have around rare diseases?
For me, I'd say genetics. In the sense that when my firstborn was born, that was like 15 years ago, we weren't sure what the problem was. By the time the secondborn was coming in, has a chromosomal disorder that could have been picked at birth with a simple heel prick, as we all know. But if you compare my journey with parents who are coming in now, the genetics discipline has grown, but it hasn't grown enough to make a difference to new parents, because they still struggle. They still find out, where can I take my child for a simple test as karyotyping? Is it being done locally? Is it being sent outside? Such basics. So for me, I would love to see more growth in genetics as a discipline in the country, because as we speak, we only have one pediatric geneticist in the whole country.
So again, getting access to not only the diagnostics, which do exist, but also having them so that they're available to the parents and then follow up. So maybe this is a perfect pivot over to you, Samuel, and then we'll follow up in terms of, I think, maybe where the situation is in South Africa as well. I mean, this sounds a bit like what you were speaking to in terms of the motivation for starting Rare Disease Ghana Initiative.
Yes, and so picking up from what has already been shared, I say that the challenges I saw at that time were multifaceted, and starting from the lack of awareness among healthcare professionals, where they are on case identification, where challenging. It's very difficult for them to identify if it's a rare disease or it's a rare disease, and be able to recommend the necessary testing and diagnostics that are needed. But apart from that too, we saw the gap in the non-existence of the diagnostic services that are needed to deliver the diagnosis, and where the doctor even has some idea, they are not able to go further with the testing to confirm if it's a condition. So patient remains, family are left in between. The doctor is unable to continue the treatment or even deliver whatever treatments may be available for the family. And we also saw the lack of access to food for those who were fortunate to get some diagnosis. There isn't the treatment available, and so it becomes a moral and ethical issue for many of the clinicians that we were dealing with. Somewhat, do we diagnose and we can't treat? What do you want to do to this family? And so that was also one of the biggest challenges that we found on not existing. But one thing that was not there is that there was no surveillance or data monitoring. So we behave like rare diseases do not exist in the healthcare system. And so, but when you talk to various healthcare professionals, they will say, oh, I've seen 1 or 2 or 3 cases, but I just couldn't do anything about it, so we left it. And so that was also something that we saw, and plus the stigma that has already been mentioned.
So just being able to get it identified and being able to be recognized. I'm going to move to Kelly then, and I think everybody talked a little bit about stigma. And Kelly, I'm going to ask you again, you've been involved in with the rare diseases, and certainly in South Africa. What are the issues with regard to stigma, and maybe associated with that mental health, in terms of the other kinds of community supports in terms of occupational discrimination? Is this something that you've seen, and is this something that you're also addressing within your organization?
Yeah, thanks, Doreen. Great question. And I think so absolutely stigmatization is something that we still see. I've actually had a patient who was a young child, and their family would only take him out to the hospital in the middle of the night because nobody in the community knew that this child existed, not even his grandparents. And I think in Africa we have lots of religious and cultural considerations, and our community here on our continent believes a lot in the cultural and inherited ancestral curses, etc. So a lot of these children and a lot of these patients that are diagnosed with these conditions are unfortunately stigmatized throughout their life. And I mean, we still see something as common as albinism, where people who are impacted by albinism literally get murdered. So it is still a very, very real thing. And I think we've got tons and tons of work to do in terms of addressing the root cause and understanding. And one of the pivotal things that we've had to learn to do is to work with traditional healers within our continent and within our country, and understand that there is still a place, and have there be a mutual respect for what we're trying to do and for what they're trying to do. Because trying to dismiss the work of traditional healers in the African continent doesn't get you anywhere. But understanding that 60% of our population will go to a traditional healer prior to seeking first world medicine.
I wish I could speak with you guys forever on some of these issues, but I'm going to pivot back really quickly to Samuel, because I've heard you talk about this. What do you do? You're working with clinicians. You're trying to bring in, not only diagnostics, but treatments. Does the lack of awareness, understanding, or even faith in some of these medicines, does it interfere even at the healthcare professional level?
Yes, and we run a pluralistic healthcare system, as Kelly has already mentioned, where patient is not just going to the hospital, they are also seeing the pastor who pray for them, and they are also seeing the herbalist who makes some herbal medication for them, and they are also talking to someone regarding their health that you you don't know about in a healthcare. And you need to think about all of these alternative treatments as part of the care. And so the issue that we know is that if we delay in getting the answer for the family, the chances of them utilizing those systems, the more, knowing very well that maybe this is hemophilia and this is the factor that the patient needs. And so if you don't diagnose hemophilia early, the parents are going to end up at a prayer camp hoping that they are being cursed, or it's a disease that they've inherited from and they will end up at the prayer camp, and the pastor or the prophet is hoping to pray to take out hemophilia out of the system. And by the time patients, they realize they can't do much for the patient. The patient's condition has already deteriorated. And so that is why you need to empower the healthcare system to identify the cases early and make sure we have in the diagnosis early and be able to provide the information to the family.
I'm going to ask each one of you, I'm going to give you maybe about 15 seconds, right, quite frankly. What's the value of working in a regional alliance? You know, I mean, you've come together, Raina, you're part of an international alliance, but also having an African alliance. What would be the value to you in terms of your work? With that, you know, why is that important? And I'm going to go to Christina, start with you, and then to Rosalind.
For us, I think for me personally, the importance is knowing that I'm not alone in a situation, that somebody understands me. Like, for example, I can talk about traditional healers and witchcraft and Kelly Blackoy. I've gone through that too. So it helps knowing that the journey that I'm in, somebody else is ahead of me, or I can help somebody behind me navigate through the hurdles and the loopholes that I have gone through.
Thank you so much, Rosalind.
I think for me, it's more like we can be able to benchmark for those who have gone before us, that they've been able to overcome or have sort of found a workaround, and also help those who are starting up. So we can be able to benchmark and be able to share ideas and see how we can, you know, work with what we already have to make it better.
Thank you. Kelly, you have been one of the most active in trying to get together, you know, regional and continent-wide African patient alliances. Why is it important for you?
Shared experience. I think that sums it up in, you know, in a short thing, is the fact that we've all had to do various things to overcome our challenges, and you can essentially save someone the time and investment of having to figure it out on their own by simply sharing your experience.
So sharing the experience you've had as an organization and how to work collaboratively. Thank you very much.
Right.
Raina, you have the privilege of actually being in an international organization, but what about the region? Is there a value? You know, your role is very much, you know, in the region. Is there a value of having a regional alliance?
We do actually, we're an international organization, but in my region, in the Eastern Mediterranean, we have something called the Hemophilia Eastern Mediterranean Network. And there is ultimate value in bringing the healthcare professionals together in the sense that Kelly mentioned, to share experiences. But as we know, I mean, Samuel alluded to that as well. You know, we talked about diagnosis being a key challenge. We also talk about access to treatment being a key challenge. Governments will not automatically prioritize rare bleeding disorders. You have a group of experts coming together, debating things like low-dose prophylaxis based on WFH treatment guidelines, demonstrating how they've applied those in their own clinics, in their own countries that look like the other country next door, and showcasing that for governments, for other doctors, for clinicians, for the families themselves. So ultimate value in networking at regional level as well as internationally, for all the reasons that I've just explained. Thank you.
Brilliant. Thank you so much. And Samuel, we're going to give you an opportunity a bit later to talk about the African Rare Summit that you were able to host. But why for you? You know, why is it important that so important to you that you actually did, you know, bring together, you know, an African summit?
Yeah, basically to understand the roadmap of where we are now as a continent, picking up from what has happened in the past, and from 2018, the 2016 meeting, 2018, and then, okay, bringing us to the stage where we know the progress we have made, also creating that environment to connect again and share experience, and also rekindle our enthusiasm for the advocacy. And so, having the platform to share learning and experience together, and it was great to meeting everyone.
Thank you so much. And huge thanks to all of you. It has been such a delight to be able to connect with you virtually. I've had the opportunity to actually connect with you in person in other circumstances. And hopefully that's going to be our next step in Africa in terms of being able to have additional Africa-wide or regional meetings there. I mean, certainly you illustrate the importance of having advocacy on the ground, being able to understand the local context, but also, as you say, what you can contribute to others who are either ahead of you, others who are behind you, but certainly to all of us in the international community. It's also very humbling when we realize the kinds of barriers and challenges and the ways you've been able to creatively address them. So thank you so very much for joining us, and we look forward to being able to dialogue with you more. Thank you.
So we do have the privilege of having Samuel here with us. In fact, I think we have most of that panel here with us. We could have done it again. And I think if you guys were like me, you would probably say, wait, I'd like to do a do-over on that one. But it was a wonderful panel, and we certainly learned a great deal. And I'd like to ask Samuel to give us a little bit of summary from the Africa Summit that was actually held recently. I think it was maybe the third or fourth Africa Summit, and I know Kelly has not only held the initial one, but held a couple of them in between. So great opportunity to talk about what is happening in Africa. So.
Good afternoon, everyone. Pleasure to be here with you. My name is Samuel Ajebia, the Executive Director. Happy to share the key recommendations from the African Summit.
We don't hear him. We don't hear you.
In March, December, we had a summit with all the hybrid event.
We had the African Summit in Ghana from the 1st to 3rd of December, which was a hybrid event. And the goal of the African Summit was to support in the harmonizing of care at the national and regional, as well as looking at it from a global landscape. We also were looking forward to promote health and social equity for persons living with rare diseases in Africa. Our challenge usually is that we, in trying to get access to certain resources for the rare disease community in our part, it's extremely challenging. We wanted to be able to bridge that gap, making sure that all patients living with rare diseases in Africa get access to the same resources. And then the event was basically to open up a dialogue, to have a discussion about rare diseases as a continent and see the way forward. This followed previous events that have been held in the region, but the first RDI event, Rare Disease International event on the continent. But previously there had been two meetings, one in 2016 and the other in 2018, both in Johannesburg. So this was the first out of Johannesburg as well. In total, we had over 300 people attending, both physically and virtual. As I said, it's a third regional meeting, and then we had about 20 African countries being from different regions of Africa being present, either virtual or physical. The summit was in 3 days, and so on the third day we had a workshop, and say 3 workshops happening concurrently. And the first workshop was focused on care management and advocacy, and people largely were patients and clinicians in that workshop who helped us to understand how we can structure healthcare as well as advocacy within. And so we came out with some actions. And the first one was to be able to improve access to diagnosis, which is one of the biggest challenges on the continent. But not just access, but we need it to be faster in terms of the speed has to be taken into consideration. Also, we need to consider cost to cost of diagnosis and treatment. Many rare disease diagnosis and treatment is pretty exorbitant, and many families are unable to pay. And because it's not insured for many African countries, families have to pay out of pocket, and it can be so financially draining. We also needed to focus on providing support on two sides. One, providing support to the medical community to be able to diagnose and manage the rare disease, as well as providing support to the caregivers. And we do that by through some empowerment programs, caregiver empowerment programs. We also need to make available mental health resources to caregivers because, as you know, many rare diseases do not have treatment, and so the challenge now becomes a mental health challenge for the family into how they can cope and adjust to the condition, move forward from there. And so we needed to have mental health resources for the caregivers. The second workshop focused on how we can build a regional alliance, which is the Africa Rare Disease Alliance. And the key takeaway was that we need to fine-tune the objectives. Why do we want to have an African alliance? What is the goal? And we need to also determine the governance in terms of how it's going to run and the network, how the membership and the stakeholder structure is going to be. And we need to identify key champions. We have some in the room already, but we need to have more in different sectors of the care. We need to have clinicians who will be key champions. You need to have policymakers who will be key champions, as well as you need patients and patient advocates. You need industry champions who help to drive. And then we need to have operational capacity for the alliance. We need to have some sustainable funding that could help to keep the alliance running. And we need to also continue our meetings, so have regular meetings as an alliance. We need to make time and meet frequently to structure and see what's working, what's not working, and how we can make it work moving forward. The third workshop focused on how we can build regional and global collaborations and innovation. And in this workshop, the key recommendation was us to have a unified voice, which has already been raised. But this time, how do we merge in projects and global initiatives? How do we have Africa represented in those initiatives? So you have several initiatives happening globally, but you realize that Africa's voice is not really represented in some of these initiatives. And so we need to make sure that Africa is duly recognized in global initiative. The other point that was raised has to do with we having capacity, building capacity across all operational levels. That is making sure that if you take the rare disease continuum or the ecosystem, making sure that there is some capacity building from the community level, from the family level to the government, to the clinical. So we need to consider every sector when we are thinking about capacity building, not just one side, not just training healthcare professionals and leaving all the others. It doesn't work. We need to consider everyone. We need to also emphasize on the data, how we will make improve visibility on data through registries, and we need to enhance the importance of that as well. We need to think of funding and then new capacity for diagnosis, such as newborn screening. So these are the key recommendations from the African Summit, and we hope that we'll be able to carry it up and moving forward. Thank you very much.
Thank you, Samuel. That was an amazing summary for an event that really did take 2.5 days and had hundreds of participants. We will have a chance for you to ask Samuel some questions at the end of this next workshop. So if there are things that Samuel said that you'd like to pick up on, learn a bit more about, there will be that opportunity. Now we're going to go to a break. And I think we have about 15 minutes or so for this break. Is that right? Okay. Okay, we will come back then in about 15, 16 minutes. We will do a second panel, and then we'll invite some of those participants who are here with us to come on stage, and we will have a conversation with them and with you. Thank you.